Thank you. I've been asked to talk about nurse-led PoTS clinics in 3 slides. So this is going to be very short and sweet. I just thought I'd quickly introduce myself. I work in Sheffield, and I started running a nurse-led PoTS clinic about 10 years ago. Started off with 1 clinic a week, and now we run 5 PoTS clinics a week, plus syncope clinics. So today I'm going to talk about nurse-led PoTS clinics and give you a quick peek at the book chapter that Helen F. Kari, who's sitting down there, give us a wave, Helen, I've written together for the practical guide for managing PoTS, which Leslie and Nick have been coordinating. So this really is a whistle-stop tour around our chapter. So what Helen and I did to begin with, we looked at nurse specialists in cardiology, because cardiology is traditionally an area with many nurse specialists. Over the years, nurse specialists have developed in arrhythmia, heart failure, cardiac rehab, inherited cardiac conditions. And cardiology nurse specialists and most nurse specialists throughout most fields have been shown to be good at liaising with the multidisciplinary team whilst running nurse-led clinics and also offering supportive self-management. And this is quite evident in areas such as cardiac rehab and heart failure. So the studies around nurse specialists in cardiology show that there's a very positive impact on patient care when nurse specialists run these services. Increasingly, over the last few years, nurse-led arrhythmia services have developed, and more recently, syncope clinics. And Helen and I both feel that embedding the active stand test in patients with suspected PoTS in both the arrhythmia and syncope clinics is essential to providing robust screening for patients with PoTS, and therefore shortening the time that these patients get to diagnosis. So we've used the framework for advanced nursing practice to give a guide really of how of the competencies and necessary things that are needed for setting up a nurse-led PoTS clinic. And we've combined this with clinical experience of nurses working within the field of PoTS to propose the nursing competencies for developing these clinics. And although we've talked about nurse specialists within cardiology, this framework does provide really a framework for anyone in any speciality wishing to develop a PoTS clinic. So there are 4 pillars to the National Advanced Nursing Practice Framework. The first one is direct clinical practice, and I suppose that's the easiest one to do because you can look at what you do in your clinic. But having said that, to enable any clinic, any nurse-led clinic to work smoothly, it requires support from admin, IT, clinical supervision. There needs to be a lead consultant, you need to liaise with the physiologists, etc. So in terms of the direct clinical practice, Helen and I looked at the history taking and how important that was, that tests were requested appropriately, that the nurse specialists use clinical decision-making skills, and in fact the clinic I work in, the nurse specialists see all the new patients with PoTS, we request all the tests, they come back to us to follow up, we give them the diagnosis, and we take it from there really. Also, with the nurse specialist in the PoTS clinic, there's a lot of supportive self-management. This lies around non-pharmacological treatments such as diet, exercise, psychological care, and referral to supportive therapies. Have you only got 1 minute left? Oh dear. I've only got 1 more slide left. And finally, it's really important that the nurse specialists initiate, monitor and treat patients with pharmacological agents. And certainly in our clinics we do initiate the pharmacological agents without really asking the doctors, if I'm honest, and titrate and monitor them using their follow-up appointments. I'm on the last slide now. So the other 3 pillars are education, leadership and collaborative work, and research and evidence-based practice. So education is obviously ourselves, going on study days like today, reading relevant articles, but also educating other healthcare professionals. In our service, we've run an educational day every year, which Leslie and Nick have spoken on, which has been fantastic. But to be honest, I'm quite happy to talk about PoTS to anyone who will listen. So I'm very boring about it, really. Leadership and collaborative work, obviously the key to this is having a strong collaboration with the clinician who's got an interest in PoTS. So your consultant, we have a great relationship with our consultants. They let us get on with it, and we know that they're there when we need them. And then also development of robust pathways, guidelines and protocols. Recently we've developed quite a nice protocol with the endocrinologists about cortisol testing, but also with rheumatology, gastroenterology, psychotherapy, all those areas that are involved in looking after patients with PoTS. We nurse specialists need to be developing those liaisons with. The last criteria or pillar in the National Advanced Nursing Practice Framework is research and evidence-based practice. And I have to say, when I've looked at this, we fall quite short on this, probably because we just don't have enough time to do it. So auditing and evaluation of services, looking at demand and capacity, which to be fair, we look at all the time because we have to keep an eye on our waiting list, quality of life measures, and patient feedback, which in the new year we're going to do a patient satisfaction survey. So basically those three slides just give an overview of what we've written for the book, and also I'm hoping that when the book comes out that people will be able to use that chapter in order to set up a nurse-led PoTS clinic.